Hello everyone, my name is Mary Samuel. I work in the HSC National Health and Social Care Professions Office. Thank you for taking the time and joining us today. You're very welcome to this webinar series hosted by the National HSCP Office in collaboration with the Institute of Leadership (RCSI). The theme for the series is HSCP Leadership in Practice during COVID-19. A key goal for the National HSCP Office is to support and develop leadership capacity within health and social care professionals. To this end, the Office has carried out an online survey to ascertain HSCP managers' feedback on leading in a time of the COVID-19 pandemic. The survey revealed telehealth and work patterns as the two areas where significant changes were made. One of them, redesign of work patterns and practices, is chosen as today's focus of discussion. I'm grateful and delighted to introduce our expert panel members, Jackie Reid, National Lead of the National HSCP Office, who has kindly agreed to facilitate the discussion. Deirdre Keating, Specialist Medical Scientist at St. Vincent's University Hospital. Michelle Monaghan, Radiography Services Manager in Conley Hospital. And Paul Nolan, Chief Cardiac Physiologist from Galway University Hospital. Thank you, panel, for agreeing to share with us your valuable leadership experiences through COVID-19. Handing it over to Jackie now. Thank you.
Okay, so thank you very much, Mary. And just to echo your words there, Mary, I'd like to add my welcome and thank you very much to all of our panelists today. I'm going to come to you first, Deirdre, if I may. Now, we're all very familiar with hearing about testing these days, and medical scientists obviously are absolutely central to testing. So I'm just wondering, we're now 7 months in since the outbreak began, and I'm wondering, is there a particular day or date that stands out for you throughout these last few months?
Hi, Jackie, thanks. Yes, I think for me it's probably the 12th of March, the day that the Taoiseach at the time, Leo Varadkar, addressed the nation from Washington. And he explained to us all about the pandemic and how serious it had become, and that from the following day we would have extra restrictions in Ireland, including closure of schools and childcare facilities. So that same day in our lab, we received delivery of a brand new molecular extractor, which is going to help us get started testing for COVID-19. And I think as we all listened in the lab to him giving that speech, it really highlighted how important medical scientists were going to be in the country's fight against COVID-19.
Wow, so a lot happening on that particular day. So you'd a lot to face into. So what were your biggest challenges? What the biggest challenges that you encountered?
Well, I suppose initially it was the equipment. We don't routinely have a molecular microbiology section in our hospital, so we were a bit at a disadvantage because of that. So before we could start testing, we had to actually get a lot of the equipment in, and there was a worldwide shortage of equipment. So luckily we got a loan of some equipment from UCD, which is just up the road from us. So I suppose that was the first bit, getting the equipment in. The second issue was the staffing. So again, because we don't have a routine molecular microbiology section, we don't have staff designated to do that kind of work. So that meant we had to take staff from our routine lab and pull them into COVID testing. So that then had a knock-on effect on our routine testing. And obviously, because the staff don't normally do that kind of tests, they're not trained to use those pieces of equipment. So we had to start training them as well on how to do this work. So they were the first two big issues. And then I suppose the final one was a big issue for us as medical scientists, was the validation of the work. We don't get to see the patients as medical scientists. We get their samples in. But we always remember that behind every one of those samples, there's a patient there waiting for a result. And it's so important to us that we give that correct result. So in order for us to do that, we have an awful lot of checks and quality control systems in place from the very second the sample arrives in our lab until we get the results at the end of it. And in order for us to start a brand new test, the validation we might do might take weeks or even months to complete. But obviously for COVID, this wasn't possible. We don't have those months, we didn't have weeks. We literally had several days that this had to be done. And it just meant staff working literally around the clock to get that test up and running and validated so it could go live as soon as possible.
So clearly a huge amount going on and a lot of pressure and a huge amount of work. So what was it like for staff going through that, Deirdre?
Yeah, I suppose on a personal level, some of our staff were actually quite worried. You know, we're humans. There's a brand new virus out there that we really don't know very much about. So they're worried that perhaps we might be more at risk of getting the virus, both because we're testing the samples, obviously, in the lab, but also just because we had to come to work. We were in and out every day, maybe on public transport. So you're more exposed to people. Second, on a practical level, the schools are now closed, the creches are closed. A lot of our staff are parents, and obviously we can't work from home, we have to come into work. So that caused a lot of practical issues for people. How are they going to get someone to mind the children at home while still working? So it involved an awful lot of communication in the lab and a lot of teamwork. People got together and decided, look, you know, I can't work mornings, but I can come in the afternoon. Some people switched their hours, so they were working much longer days and then had other days off. Other people worked weekends. But basically everybody found a way to come in, no matter what they had to do, no matter what kind of arrangements they made, everybody made it into work, which was really showed, I suppose, what a great team we had.
So Deirdre, I'm conscious that you're a specialist scientist in a leadership role there in your lab. How was it for you during this time?
Yeah, I suppose initially there wasn't even time to think about it. It was just do it, you know, get in there and do it. But as things got on, and I suppose every day it seemed that there was another issue. Sometimes there was no swabs to take the samples, and then there was reagent issues, consumable issues, and there was an issue with plastics. So, I mean, it did get intense for quite a while. We were in, and obviously it's when a new reagent comes in and you have to substitute in, that's a whole new validation that has to take place. You can't just substitute one in instead of the other. So there was an awful lot of very, very long nights, and we were really doing as much as we possibly could. And I suppose sometimes when you're coming home and it might be, you know, 11 or 12 o'clock at night, and all you could hear was maybe on the radio, on the news, people saying, oh, what's the problem here? Why can't you get testing quicker? And, you know, what's wrong with these reagents? Why can't you just use something else? And then we get home and there'd be more, you know, seemed like people were personally attacking you. And then online as well, you know, it was just a constant pressure from the public saying, well, you know, what is wrong with these scientists? Why can't they just make this work? So I suppose it did get overwhelming at one point, but eventually I just had to say, right, I need to take a step back here and just put it into perspective. I mean, this is a brand new virus. This is a global pandemic. Everybody in the world is looking for the same reagents, using the same equipment. So obviously there's going to be teething problems. And every day we were learning something new, and we're making it a bit better every single day. So I suppose just taking that step back and taking a breath and saying, right, we're doing everything we possibly can. And every day we're learning more.
So in the midst of all that, you took your step back, and I'm wondering, still a lot of pressure. How did you mind yourself or sustain yourself in this during all of that?
Yeah. So we do have to take some time out for yourself, I suppose. I was lucky. My husband is also a frontline worker, so we made the arrangement that we'd work completely opposite each other, so we didn't have to worry about childcare. So when I was in work, he was at home. So I suppose that initially took the pressure off me on the home life. I didn't have to worry about, you know, who's going to mind the kids today, or who's going to be putting them to bed, or having to run out the door, you know, to collect them from somewhere. So that just immediately took the pressure off in that way. And then I suppose when I was home, I just made the most of spending time with my kids, and we're very, very lucky that we live close to the beach. So we went for walks every day if we could, and just getting out into nature and into the fresh air really helped me, helped my mental health. And I mean, obviously there's the disadvantage that, you know, I didn't get to see my husband very often, but I suppose we made the most of whatever little time we had together, and then obviously with the kids as well.
So with having gone through all that, where you're sitting now, like were there any good things to come out of all of this demanding situation you've been describing?
Yes, I know, you know, it's probably hard to think of, you know, good things out of a global pandemic, but it was amazing actually. You know, if you do sit down and think about it, there are good things. I suppose the main thing was the teamwork within our lab. I mean, we always knew we had a good team system in place, but it just highlighted how accommodating everybody is. And, everybody has stresses in their personal life and, in their work life, and yet all coming together as a team to make this work in the lab itself. And then, the medical scientist community was amazing. We're a very small group anyway, so there would be connections already there. You'd normally know people working in different labs, but this kind of brought it to a whole new level. We had WhatsApp groups going, video calls going. There was people driving from one end of the country to another with supplies for other labs because they had run out. It was a real community system in place. And I suppose, at one stage, the Matter, we were able to use their machine because ours had broken down. So, even them finding time in their busy workday to let us bring all our stuff over and use their machine, that was amazing teamwork. And I suppose it was really nice that the public actually knew who medical scientists were. On a personal level, I found that nice. This time last year, if you'd ask a member of the public who medical scientists were or what we did, they probably wouldn't have had a clue. So just, I suppose, bringing our profession to the fore. I mean, we feel like we're an important part of the health service, and it was nice to maybe be acknowledged that, yes, we do play a part in this.
Thanks, Deirdre. Well, you certainly are an important part of the health service, and we all realise it now. So just finally, Deirdre, just I suppose, where are you now? Where are things at now?
Yeah, it would be lovely to say that everything is perfect and, our system is working perfectly smoothly. But of course, every day is changing with COVID. Every day is new in this pandemic. We still have some reagent shortages. There's still some issues with plastics. I mean, the suppliers can only supply as fast as they can, and demand is growing every day. We're getting a new system in soon, so I suppose that will take the pressure off reagents in that we won't be relying on one company anymore, but that'll bring other issues with that. Staff obviously will have to be trained on this brand new system that we've never used before, and obviously the tests will all have to be validated again on this new equipment. So there, I suppose, two main challenges from that practical level. But I suppose on another level, the issues with the staffing. Our staff are very tired. They've given everything they had for the last 7 months. And, initially there was a huge adrenaline push when this got started in March and April. Everybody was kind of high, wanting to get this done as quickly as possible. But after 7 months, people are starting to wane now. And, I'm just feel very conscious, and, I feel a responsibility to the staff. So, I'm constantly checking if they're all right, making sure that they're taking their full breaks, because, it can be very intense in work and people kind of forget, or they think, oh, I'll just take a short break. But just reminding people how important it is, take your breaks. If you have the chance to take a day off, take it, try and get that separation from work. I mean, a lot of our staff are living away from their families. They can't go and visit them. So, just doing something nice and, reminding them that we are a team and we're here for each other when we need it.
Well, thank you very much, Deirdre. Thanks so much for sharing your experiences and your journey over the last few months. Thank you.
Thanks very much, Jackie.
Now I want to come to Michelle Monaghan, Radiography Services Manager. Radiography, as we know, is another one of the big diagnostic areas in health and social care professions, and I'm sure an area that has experienced a lot of increase in demand and change during this time. I wonder, Michelle, if you could share with us a little bit about the changes that have happened in your workplace as a result of COVID-19.
Okay, thanks, Jackie, for having me. So I work in a department where at the start of the pandemic, we had 27 whole-time equivalent radiographers. We were carrying a number of vacancies at the time, and I also work with a team of 14 healthcare assistants. So 8 would be on duty at any given time. So even before Leo announced his lockdown, unfortunately, we had cases of COVID within the department. So straight away, I was down all senior radiography staff. So instead of having 20 on the floor, we had 11. And the same across the healthcare assistants, we were down by about two-thirds by about a third. So whereas a lot of other radiography departments were starting in pods so that there wouldn't be crossover, we were already just decimated. The increased volume of portable x-rays was significant, and I think one of the most significant factors across the diagnostics, because we have to x-ray every patient that comes in, query COVID or positive COVID. So the amount of portable x-rays went up by 500% overnight. We have had old equipment, which is analog equipment, over 20 years old. So that was an issue in and of itself. Fortunately, through the pandemic, we were able to upgrade some of the analog to digital by getting detectors. But the staff themselves had to double up on everything they were doing. They had to cover the 24/7 roster with half of them, and they all did that. We had to diversify some other people to go on portables, cancel some of our outpatients so that we could manage our inpatients. So it was a complete revision of how the X-ray department worked. CT had to go full pelt because most of the COVID patients had to have CT. One of the significant things was donning and doffing of PPE. So as you can imagine, if you're doing 40 portable X-rays a day, that's 40 times you have to take on and off PPE and make sure you do it properly, dispose of it properly, work with your healthcare assistant, try and have somebody who is touching the patient and somebody's not touching the patient, which technically or not technically, we term them as clean and dirty. So it's probably not the most politically correct, but that's the way you do it. So the whole work practices of everybody had to just change overnight and work more towards CT and portable X-rays with a diminished amount of staff. So that's why I think where teamwork came in hugely, because everybody just pitched in. People who were supposed to be off came in, and people did did more on call than they should have done, but they all did it, and they all did it well. So I think that was a huge bonus for all of us that we worked together so well.
Thanks, Michelle. That sounds extremely challenging and a huge amount to cope with in a short amount of time. Can you tell us a little bit about how did you communicate with and support your staff through all of that massive change?
Yeah, that was difficult because it's not something we'd ever faced before. But fortunately, the hospital management held a huddle every morning at 10 a.m. So they outlined to line managers in the auditorium what was happening, how many COVID patients we had, how many queries we had, what was going on, whether or not theatres were running, how we were managing the ICU situation, which was key because the CCU had to be switched into an ICU. Theatre recovery was a third ICU, and then CCU had to be put into a ward. So at 12 o'clock every day, I would have my own huddle with the staff in radiology, impart to them all of the information I had so that they knew what I knew. And that empowered staff to feel that they actually knew what was happening in the hospital, which was hugely important for even staff morale, so that they knew what they were facing, they knew what was in, they knew how many patients were there. And I think that kind of communication is key, because they knew that what I knew, they knew, and I knew that what hospital management knew, I knew. So it was a two-way communication all across the board. And I think that was hugely important, that everybody felt part of the circle of knowledge and that they knew what was going on in the hospital, who was in, who was out, which departments were hit, how many patients we had, because we actually at one point went up to 67 inpatients, which for a hospital the size of with 300 beds is quite significant. So proportionally at quite a number of weeks during the pandemic height, we had the highest proportion of inpatients compared to beds in the country. So the staff were feeling stressed, so that I didn't need them to feel isolated as well. So that was important, not to have staff isolated within their own pocket or pod, but that they knew where to go, where to resource support, where the support was there, and that they had all the key information that we had. Like every day we got PPE updates, because in the beginning it was just a little bit of a challenge to get the PPE to the hospitals. So every day they would know how much PPE we got in, where it was, that the department was being looked after, and those kind of things were very important for staff to allow them to work in an environment that they never had before. So that's how we worked it out.
All of that communication clearly really helped your staff to cope with that situation. I'm just wondering, Michelle, what was happening with outpatients at that point in time?
We didn't set out to cancel outpatients, but in fact, many outpatients would phone us and say, we're not going anywhere near a hospital. So at the point where the private hospitals became public hospitals, that was the point at which we utilised their diagnostic services for outpatients. So in line with it, this caused a lot of work for everybody, because including the clerical admin staff, because due to GDPR, you had to phone the patient and say, look, we're now sending your information to a different hospital. Is that okay? So we sent out a lot of our outpatients for diagnostic services to the private hospitals, which were now under the public hospital regime. And that helped us not to build up a huge backlog when outpatients started to come back in after June. We didn't end up with a larger waiting list than we started out with, and I think that's hugely important for patients as well, so that they felt that their service, they were being looked after, they were being remembered, and that they were getting their tests in a good period of time. So we're still working on it, because some patients didn't want to go anywhere. They were cocooning. They were of an era where they're cocooning between some health conditions and age related. So it was important that we now look after them, because they said, don't call us till October, thinking that everything would have settled down. And now here we are in October, and it's all starting off again. So we are looking at it's a balance to match the new inpatient requests, but not to forget anybody, and make sure nobody goes through any cracks, and that they're all looked after.
And just lastly, Michelle, thanks for sharing all of that. I'm wondering, in terms of where you're sitting now, like, what would you say was your greatest learning, or what had the greatest impact during that time?
I think for me it was looking at people and trying to make sure how the people in the environment reacted, because everybody reacted on different days in different methods. Some people were fine with the PPE, wearing it all day, and then the next day they would just be so claustrophobic, having to put on the mask and the hazmat suit and the goggles, and that day they couldn't handle it. So I think it was so important that I learned how to look after the staff, support the staff, and make sure that if somebody was vulnerable today, they were with somebody who wasn't, and then shift that around, because the vulnerabilities didn't stay the same all the time. Everybody had good days and bad days, and that you looked after everybody, and that you were aware that even the strong had bad days, and to make sure that you were looking out for everybody, and that everybody, and I think that was a huge learning curve for me as a manager, in that you never say, well, this is my strong cohort, or this is not my not so strong cohort, because everybody was team, and watch each other's back, and everybody did that to such a huge extent that it's great to be able to say that you're part of such a team, and that all work together and help out on call, come in early, go home late. So I think that was a big learning, that when the chips are down and you require teamwork, that's exactly what happened. So, and I think also to ensure that people, because there was nowhere to go and no holidays to go on, to still ensure that people took time off so that they could have a day to themselves. For a number of staff, childcare was an issue. Some staff, their childcare was fine, and other staff, they had none. So it was to try and work around all of these individual things, but we did it by coming together as a team and each person helping out each other person on a day-to-day basis. And I think that was a great learning, that we can do it and we can all work together, we can all work as a team, and we can all work well, and our patients are looked after. And one of the things I have to say, no visitors were allowed. And a lot of the patients we were getting and looking after were very, very ill. And their families weren't able to come in. So we were their families. So I think we're all empathetic with our patients and we all look after our patients. But the additional responsibility for that time when people just couldn't see their family, it was so important to do the one-on-one piece, even if you were in the hazmat suit with the mask, just to be personal for those people, just so they didn't feel as alone as they must have felt. And so that we could say to the families, we're looking after your loved ones. And I think that's a huge learning as well, that we need to put the patient at the centre, and when they have nobody, all they have are the people looking after them. And we need to step up just that a little bit more and be their family for that duration of time.
Thank you so much, Michelle, for sharing those insights. It's very powerful, and I really thank you for that. I'm now going to zip across the country to Galway to Paul Nolan, Chief Cardiac Physiologist in Galway. I'm conscious that cardiac physiology is perhaps one of those diagnostic areas that not everybody is quite as familiar with. I see you're helping us out with the poster behind you. So a good opportunity for people to learn a little bit more. I'm wondering, Paul, could you tell us a little bit about your team and the structure prior to COVID and the kind of work that you did during COVID there in Galway?
Yeah, thanks, Jackie, and thanks for the invitation. You're right. Sometimes I think my wife doesn't really know what I do sometimes. So we've a team of 17 cardiac physiologists here, and we perform and report all the non-invasive cardiac investigations like heart tracings, exercise stress testing, the heart ultrasounds or echoes, and we look after patients' implantable defibrillators and pacemakers. We lead that service under the supervision of the consultants, and we're also part of the team that deliver angio, the imaging the coronary arteries, and fixing of coronary artery narrowings with stents in the cath lab. So we've a significant role in terms of non-invasive and invasive cardiac care, and we're also part of what we call the Code STEMI team, which treats, along with nurses and our radiographer colleagues and doctors, treat patients who are having certain types of heart attacks within 90 minutes of their first heart tracing, whether that be whether that heart tracing be taken in the community or in our own ED or an ED in Mayo. The plan is to try and get them into the cath lab and have their vessel opened within 90 minutes. And that's a 24/7, 365 days a year service. So there's always a physiologist in the primary PCI centres on call for that service.
Thanks, Paul, for giving us that outline. And could you tell us a little bit about how COVID-19 then affected that service you're providing there?
Well, I suppose in terms of initially there was huge anxiety and uncertainty around how we would deliver our service, uncertainty and concern around staff about how they protect themselves, whether they catch the disease, how many patients would have it, whether they could potentially bring the infection home to somebody else in the house that might be vulnerable. There was also a huge concern about whether we might get redeployed. So when there was talk about surge ICU and we had visions of maybe one ICU nurse looking after 5 patients in an operating theatre on ventilators, that we might be redeployed to look at heart tracings and pressures, because that's something we specialise in. So there was an awful lot of uncertainty and anxiety, and I suppose we addressed that by having an initial meeting with our team, and really we were very open and honest about what the fears and concerns were, and we tried to answer them as honestly as possible. There was a number of, I don't know the answer to that, and a lot of honesty about what we did know and what we didn't know. It's something that we never historically had very regular staff meetings, because I'm very operational, so I'm on the ground a lot performing diagnostic tests. We daily huddles where we would share rapidly changing information. The hospital introduced a one-page daily update, so we shared that. We looked at the HSE operational update in terms of the COVID numbers, and that was great because it took the anxiety away from people who could say, like, currently this is a situation in the country, this is what our hospital has, this is how many ICU beds are empty, this is how many people we have in the hospital with COVID, how many ICU beds are free. So it really, giving that information, I think, helped reduce the anxiety levels within the team, because people had the information, very much what Michelle was saying, they had the information that we had, that the hospital management had, and I think that really helped. We shared that information at the daily huddle, but also we set up a COVID WhatsApp group to support as parallel to our own work WhatsApp group, and we shared other information like well-being infographics from the Wellbeing Division, the HR and the HSC, and also the Employee Assistance Programme, and some of those very simple advice about switching off social media, not constantly watching the news, getting out and having a walk, that really helped. And we sort of had this mantra that we had early on about getting through this with our health and our relationships intact, and we repeat that a number of times through the sort of peak of the pandemic. And it's something that we really worked on, and we tried to maintain as we went through it.
And Paul, just to ask you a bit more about that, were there changes then, other changes in work practice, or people's patterns of work and things like that as well?
Yeah, there was. I suppose there was some significant changes. I suppose one of the very first changes was that pathway, how we treat those heart STEMI pathway. We really had to look at that and change how that works substantially, and that was the whole interdisciplinary team getting together, looking at how we did things, because we could have a patient, in a COVID STEMI situation, we could get a phone call saying from the ambulance service saying there's a patient with a heart attack on the way, they'll be with you in 30 minutes. And at that point, we had to sort of say, are they maybe COVID, possible COVID, high suspicion of COVID? And we had to have a pathway in place to manage that. So we had to really work out how we would deal with a COVID positive or potentially suspicious COVID patient while delivering a good service to them, but also protecting our staff. So we really worked hard and very rapidly changed our pathway and how we manage those patients. And it involved not only our team, but also healthcare assistants that would normally work in the department. And so it was a real change to how we did things, and I suppose a real lesson how when you're focused, you can really change quickly how we operate. I suppose the other major change for us is in an effort to protect our staff, and Michelle referenced breaking into pods. That's what we did as well. Our whole cardiology service, from doctors to nurses to radiographers to cardiac physiologists, split into 2 separate pods, 4 days on and 3 days off. And that really was a challenge in terms of making sure we had enough staff to deliver service, that there was enough skill mix in each pod, and then also that we maintain that sense of team that we've built up over the years while being split into 2 pods. So that gave us extended hours. We had weekend working to support our green ED that was situated in the MAU. So there were huge changes to try and both not only protect our teams, but also deliver the best service that we could with those reduced teams in a busy time in the hospital. Clearly
a huge amount of change happening there, Paul, and a lot to cope with. How did you keep people on board through all of that?
I didn't, to be honest, so I've only one person left now. I think the main thing was that it was really around co-design. So for example, when we talked about the pods, we sat down as a team and we said, how are these pods going to work? What are they going to look like? And very simple things that mightn't have struck me. One of the staff came to me and said, you should try and put people who are living on their own in the same pods, so that potentially they could, socialize, meet outside of a work environment if they needed to chat or de-stress, rather than coming into work doing a 12-hour day and then going home to an empty house. So the fact that they were in the pods already meant that they could potentially meet up, have a coffee, that type of thing. So it was a very simple idea like that hadn't struck me, because obviously I'm married, so I have someone at home. I think we really have a very strong sense of team. We've always had it, and that's down to the physiologists that are here. There's a real ethos of minding each other. That's been in place for a long period of time, and simple things in terms of someone's late in the lab, checking that they're okay, that they don't want a cup of tea before everyone goes off and leaves them on their own. And I suppose what we've built up over the years really came to the fore in that difficult period of change. We really, as I said, minded each other. We wanted to maintain our relationships through a stressful time. People were baking, bringing in stuff into the department, chocolate biscuit cake. We had a lot of banter on the work WhatsApp, and I think there's a real sense of trust within the team, and people, I think, felt that even though they mightn't fully have agreed with the way we were moving or decisions that had to be made, they knew in their heart that I was looking for them, that the were being made in the best interests of the service and also of our team as a whole. And I think what we've built up over the years really was what helped us come through that and kept the whole team together as that change happened. It's really priceless, and reflecting on it, I would say it's so invaluable. It takes a long time to develop, and it can be damaged very, very easily, and we have to be very careful as leaders, that managers, that we're careful not to damage that type of money in the bank that's been built up over years.
Thanks, Paul, for that. And just picking up on your reflections there, just as you sit here now and reflect back, like, what would you say has been your key learning as a leader?
Well, I suppose one of the first things is that there was huge pride in the health service, also in our health and social care professions colleagues, maybe people that aren't often seen, like the work the medical physics people and biomedical engineers put into procuring equipment, commissioning equipment. Even something that wouldn't have struck me is like, if you plug in an extra 40 ventilators, will the oxygen supply in the hospital be able to supply those ventilators? All that type of stuff, the work that went in behind the scenes, sometimes the med lab scientists, is just amazing, and huge pride in that work. The strength of our team, as I said, and how invaluable that is. And I think when we split into the pods, the major learning for me was I'm sort of very, very operational, and I'm on the ground a lot. And when we split into pods, I was really worried about that there'd be 3 days I wasn't there, and how would the team cope? And what I learned very quickly is people stepped up. They grew into the roles. They took on extra responsibility. And my big learning, I suppose, is not to sort of go backwards in that, and not to start micromanaging people again, to allow them that space to grow into roles, to take on projects, and to manage some changes within the department. The other thing I think that was one of the positives of COVID, if you can sort of look at some positives, is how quickly we change things. So, for example, we've been talking for 6-9 months about getting our sort of, we do about 9 different tests on 9 different bits of equipment, and getting those results onto our electronic patient chart, Evolve, in the hospital. And we've been talking about 6-9 months about doing that. We got it done in 3 to 4 weeks, again through the help of medical physics and the IT department. So how quickly we could do stuff like that, I think, is something we should try and hang on to. And then also reflecting what Michelle said, I think from the patient's perspective, I think the human contact, whether we were ringing patients at home, because we also check people's cardiac devices remotely via internet technology, and we would typically ring them and say, we've checked your device, everything is fine. And those conversations were longer because people who were cocooning wanted that human contact, and also people in the hospital with no visitors also wanted that human contact. So while it's vitally important normally, I think was even more important during the pandemic, and I think really important to remember how important that is to patients. And the thing I always sort of say is to ask a non-clinical related question to a patient, because you'll be amazed at some of the answers you get, and it can start some very enriching conversations, not only for the patient but also I find for me personally, I sometimes get great crack out of them.
Thank you so much, Paul, for sharing those insights, and thank you again to Deirdre and Michelle. I think you've all shared some really personal and impactful learning and experiences from this period of time. So I really do appreciate that. I'm now going to hand back to Mary to wrap up.
Thank you, Jackie. As the panel members shared their experiences, each of their leadership journey through COVID-19 was unique and distinct. Deirdre's experience highlights the importance of stepping up to the need and also stepping back, reflecting, evaluating information during the overwhelming experience, being resilient, and responding appropriately. From Michelle's sharing, it was evident how, as a leader, she had to be emotionally connected to her staff, being open, honest, transparent, and timely with her communications. She also emphasized on the importance of developing the capability of staff as we navigate through unknown waters. Michelle's sharing specifically on seeing the person behind the patient is a powerful example of compassionate leadership. Paul reminded us of the qualities in a leader which are required to put collective leadership in practice. He highlighted the need to step back and allow others to grow, to create an environment where the culture of minding each other is prevalent. This then translates to team members being willing to stretch and to take other roles and responsibilities and coming together to co-design changes. I'm sure you would join with me in agreeing all our panel members in their distinct ways demonstrated leadership skills in a practical manner during a pandemic. I would like to take this opportunity to thank everyone involved in this webinar, the panel members, Ms. Tina Joyce from RCSI for her expertise and guidance, and Suzanne and Miriam from the operational and technical crew of RCSI. Our contact details and other details relevant to this webinar are displayed on the screen. Our next webinar will be on the HSCP leadership in practice in the area of e-health. We look forward to you joining us at the next webinar. Thank you.